In the video series of neurology medicine, today I will discuss the Lambert Eaton myasthenic syndrome. So, how you can differentiate the Lambert Eaton syndrome from Myasthenia Gravis. So, first we will discuss the similarities between them. After that, we will discuss the difference between them. So, what are the basic similarities between the Lambert Eaton syndrome and Myasthenia syndrome? So, that is both have impaired neuromuscular transmission, right? Both have impaired neuromuscular transmission, and second is both are autoimmune diseases. Both are autoimmune diseases, meaning antibodies are present within the patient's circulatory system. Now the third is produce muscle weakness, and that muscle weakness should be painless muscle weakness. Points you should never forget that these are the major similarities between them. The first is both have impaired neuromuscular transmission, both are autoimmune diseases, and both produce the painless muscle weakness. So now let's talk about the differences between the myasthenia gravis and Lambert Eaton syndrome. So what are the differences? Let's say this is myasthenia gravis and there is Lambert Eaton syndrome. So in myasthenia gravis, the autoantibodies, they are directed against the postsynaptic neuron. Like, let's say if this is the presynaptic neuron and that is the postsynaptic neuron. So in myasthenia gravis, the autoantibodies will be directed against the postsynaptic neuron, and it will act on which receptor in the postsynaptic neuron? That is, yes, cholinergic nicotinic receptor. It's important. So in myasthenia gravis, the autoantibodies are directed against the cholinergic nicotinic receptor on postsynaptic membrane. I already make a detailed video in the myasthenia gravis. I will provide link in the description as well. Now, in myasthenia gravis, the autoantibodies are directed against the cholinergic nicotinic receptor on the postsynaptic neuron, or autoantibodies could be directed against the MuSK receptor. Which receptor? That is MuSK receptor. That is muscle specific protein kinases. Basically, these are tyrosine kinase receptor. So the autoantibodies could act on the nicotinic receptor or it could act on the MuSK receptor. In Lambert Eaton syndrome, the autoantibodies are directed against the presynaptic neuron. So let's say this is presynaptic neuron, this is postsynaptic neuron. So in this condition, the autoantibodies are directed against the presynaptic neuron, and which receptor? That is voltage gated calcium channel. So here the autoantibodies directed against voltage gated calcium channel in presynaptic neuron. So always keep in mind, the myasthenia gravis is the disease of postsynaptic neuron and Lambert Eaton syndrome is the disease of presynaptic neuron. Secondly, the myasthenia gravis, it is associated with thymic abnormalities. So it is associated with thymic abnormalities, and in 10% cases it is associated with, yes, in 10% cases it is associated with thymoma. Now Keep in mind, thymoma is neither it is a tumor of T cell nor it is a tumor of B cell. Rather, it is a tumor of epithelial, and most of the cases thymoma is benign, but it could be malignant as well. So whenever you are suspecting thymoma, it's important you have excised the thymoma earlier. So in 50% cases, it is associated with thymic hyperplasia. While in another hand, if I talk about Lambert Eaton syndrome, so unfortunately it is associated with carcinomas. So in 50% cases, it is associated with which carcinoma? That is small lung cell carcinoma. So in 50% cases, Lambert Eaton syndrome is associated with small cell lung carcinoma, while remaining 50% cases, it is associated with autoimmune diseases. And that autoimmune diseases could be vitiligo. What is vitiligo? Vitiligo is autoimmune process in which the melanin producing cells are destroyed. As a result of that, the patient have a white patches on skin. It is different from albinism. In albinism, it is usually inherited condition, but it is an autoimmune process. Also, it is associated with Hashimoto's thyroiditis, in which the autoantibodies are directed predominantly against the thyroid gland. Also, it is associated with Graves' disease, and it is associated with type 1 diabetes mellitus, autoimmune process that destroy the pancreatic beta cell which produce the insulin. Now let's talk about the clinical differences between the myasthenia gravis and Lambert Eaton syndrome. So in myasthenia gravis, problem is typically associated with the cranial muscles. It's important. It is the problem associated with the cranial muscles, and mainly that is intraocular muscles. So this patient will be manifested with ptosis, diplopia. They may have a problem and difficulty in chewing, and difficulty in talk, and difficulty in swallow. Now after that, these weakness can spread to the neck region, and then it can involve the lower extremities as well. So always keep in mind, in case of myasthenia gravis, the eye signs will appear first. Eye signs will appear first. It will appear first, then gait problems. Right? So in Lambert Eaton syndrome, it predominantly it affects the lower girdle. It affects the lower girdle. Mainly, it affects the lower extremities, and after that, the weakness spread to the upper region. So mainly, in case of Lambert Eaton syndrome, there will be hip weakness, and when the weakness spread to the upper region, so it can affect the shoulder muscles as well. So in Lambert Eaton patient, they usually uses hip while upgoing stairs, or they also uses hips while standing from the sitting position. In case of Lambert Eaton syndrome, the gait problems appear first. Gait problems appear first, then eye signs. Sustained and repetitive efforts lead to increased fatigue in the myasthenia gravis. So sustained repetitive efforts on muscle lead to very much fatigue. So whenever the muscle is repeatedly stimulated, so there is of course muscle weakness. But in case of myasthenia gravis, there will be extra fatigue. But in case of Lambert Eaton syndrome, when you are repeatedly stimulated the muscle, there will be transient increase in power. There will be transient increase in power. What are the other differences based upon the investigations? So the first is you have to look for the autoantibodies for both. So So if there is myasthenia gravis, so autoantibodies will be directed against the postsynaptic nicotinic cholinergic receptor, or it will act on musk receptor. But in case of Lambert Eaton syndrome, the autoantibodies will be directed against the presynaptic voltage gated calcium channel. Or you can do the CT or MRI. So if there is thymoma or thymic hyperplasia, so we can do CT or MRI to look for the myasthenia gravis. Or if there is any carcinoma, most predominantly small cell lung carcinoma or any autoimmune diseases, so in that condition we have to do the CT or MRI for the Lambert Eaton syndrome. But what is the most important investigation? When you are repeatedly stimulated the nerve for a specific muscles, and if there is decremental response, if there is decreased response, so that will be myasthenia gravis. But when specific nerve is stimulated for a specific muscle, and if there is incremental response, then that will be Lambert Eaton syndrome. What is the treatment for the myasthenia gravis and Lambert Eaton syndrome? So in case of myasthenia gravis, you have to give the anticholinesterases, mainly pyridostigmine and neostigmine, right? You have to give the anticholinesterase. You can inhibit the production of autoantibodies by immunosuppression, right? That is immunosuppression. You can inhibit the autoantibodies by immunosuppression. Also, you can inhibit antibodies by plasmapheresis. And of course, at the end stage, you can do thymectomy. But in case of Lambert Eaton syndrome, the anticholinesterase is not effective. In this condition, we can give the 3,4-diaminopyridine. 3,4-diaminopyridine. You can inhibit the antibodies production by immunosuppression or plasmapheresis, and if there is carcinoma, then you have to treat that carcinoma as well, right? So that's all about the difference between myasthenia gravis and Lambert Eaton syndrome.